being recorded
for the city of Malden. It is being co-hosted by the Greater Malden Asian American Community Coalition, and we have panel guests from the Malden Board of Health, from South Cove Community Health Center, and from Chinese Culture Connection. Today's event is going to be interpreted into Mandarin Chinese as well as Vietnamese. For audience members, if you could please, audience members watching on Zoom, if you could please look at the bottom of your screen. There is a button that looks like a globe with the interpretation label on it. You can click on it and choose between the main channel, which is in English, the Chinese channel, or the German channel, which is actually in Vietnamese. So I'm just going to repeat that again so that people can have the opportunity to choose their language channels. Again, if you're watching on Zoom, please go to the bottom of your screen. There is a button that looks like a globe, and that has interpretation labeled. If you click on it, you can find either English, the main channel, or the Chinese channel, which is in Mandarin Chinese, or the German channel, which is in Vietnamese. We might just repeat this again later on, so for people who join later. But if you would stay with us in the main channel, we will be speaking in English from now on. This event is also going to be broadcasted live on MATV tonight, as well as in Mandarin Chinese tomorrow. So there will be many more opportunities to look at it. And also there will be recordings available online on our GMAC Facebook page and in other places as well. Great. So without further ado, I think I would like to welcome our guest panelists tonight. Next slide, please. So our panelists tonight will include Gary Christensen, who is the mayor of Malden. Unfortunately, it looks like he is not here right now, but hopefully he'll be able to join in a bit. We have Mr. Tong Liu, who is the health inspector for the Malden Health Department. We have Dr. Rong Guan, who is the medical director of South Cove Community Health Center. We have Timothy Guan, who is a high school student who will be sharing with us his experience getting vaccinated as a teenager. We have Mei Hung, who is the executive director of Chinese Culture Connection, and that is a community organization here in Malden. We have Michelle Yuan, who is the vaccine outreach coordinator for Greater Malden Asian American Community Coalition, who has been working with the city to try and promote the COVID vaccine. And I myself, Jenny, I am your moderator tonight, and I am the program director of Greater Malden Asian American Community Coalition, or GMAC for short. So thank you so much for all of the panelists and the organizations that supported this event tonight. I also wanted to thank the Massachusetts Department of Public Health and Healthcare for All and the media company ASG for helping us produce and publicize the event tonight. So today we have these community leaders and experts in their field who will be talking to us, help us better understand the COVID vaccine, what the state of vaccination is in Malden currently, what people need to keep in mind, why is it still important to get vaccinated as the city continues to reopen, and to be able to answer everybody's questions. So thank you all so much for joining us today. So I think right now, I believe that the mayor is still not signed on yet. So let's go to Mr. Liu for now. Tell us a little bit more about the state of vaccines in Malden City right now. So I will be asking questions and Mr. Liu can help us answer them. So for Mr. Liu, right now, what is the current breakdown of people who have already gotten vaccinated in Malden?
Hi, everyone.
Well, for the people who is fully vaccinated, as of today in Malden, the count is 37,000. Okay, 37,000. Okay, this is about 55.9% vaccinated, fully vaccinated. Okay, I'm not talking about the one who only got the first dose. Those considered partially vaccinated. In terms of the gender, always the female is higher than the male. The woman got about like 56%. Okay, another word about like 19,000 female. For the male, about 17,000. Okay, think about this. Malden has a total population is about 67,000. So for the male is 17,000. For the female is 19,000. Okay, the ratio between the male and female vaccinated is the same as the ratio compared to the state level. Okay. Now let's talk about the age of the vaccinated people. Okay, for the 75 years older, we got about 81% vaccinated. 65 to 74, we got about like 83, 84%. From we call 0 to 64 age of about 50%. Now think about this. As we speak, the school is doing the clinic right now for the school age. Okay, so they are in the school right now, and also tomorrow and next day we are going to have the town hall clinic also. Okay, and do you want to break down the racial group? We are pretty much consistent with the state. Okay, for the white population, it's about like 14,000, almost 15,000. The ratio is about the percentage is about like 56%. It's higher than the state. The state only have 55%. Okay, just 1%. For Hispanic, Latino, we don't have a lot in here. It's only like 3,000, about 3,000 people vaccinated. But compared to the population, we got about 42%, which is much higher than the state. Okay, the state has 35%. But think about when they say the state, they're comparing to like on the Western Massachusetts. I mean, all those, those towns, they don't have a lot of people from South America. Okay, so think about that way. The Black, I don't know what is Black. Okay, Haitian, sometimes they don't want to be labeled as Black. So I don't know what you want to call it. The Black, okay, dark skin. We have about like 3,500 people vaccinated because we host a Haitian community vaccination. We went to the Haitian church, invite them to come in and have interpreter to help them to vaccinate. That boosts up the vaccination rate for the Haitian community. Okay, now they don't label them as Black, they label them as something else. So I don't know what you want to call. Anything you want to call, that's fine. The percentage of that for the populations in Malden is about 25%. On the statewide, it's at 38%. So in Malden, I don't want to say we have a lot of Black people, but we do have a lot of like dark-skinned people. Okay, so I don't know how are you going to interpret that Black is Black. Okay, Asian, we have a lot. We have like a little bit over 10,000 vaccinated. Okay, that is about 54% of the city population. Okay, that's very high because the state is 55%, we have 54.2%. It's very comparable to the state level because Malden has a lot of Asian, okay. In Malden, we have about 27% as an Asian population, okay, 27%. White is only 38%. I mean, like not so far off compared to the white population. Then some American Native, like Alaskan, we only have like 38 because the population very low, 38 people vaccinated, but that contribute to 47% in terms of the population. And on the state-wise, the state is only like 31.9, so it's 32%. So we are much higher. I mean, the overall, the percentage-wise, Malden is doing very well the way I look at it in terms of vaccination.
Great, thank you so much for sharing all of that information with us. It's very helpful to know. I think just to summarize, because this event is aimed at Chinese-speaking and Vietnamese-speaking community members, you know, we are most mindful of the statistics around Asian Malden residents. So it's very encouraging to hear that Asian residents are about 54% vaccinated, fully vaccinated in Malden, which is about on par with the state statistic.
Right.
Well, 54% at the same time is also not all the way to 100%. So I'm wondering if you can tell us a little bit about what the city of Malden plans to do over the next few months to continue to ramp up vaccination efforts.
As we speak, we try to use up all the vaccine that we have on hand, okay? We still have a lot of J&J because the J&J vaccine, after the bad news came out, people doesn't want it, okay? However, tomorrow and Thursday, we are going to have a City Hall walk-in vaccination clinic for J&J. We also offer $25 Target gift card for the first 50 people sign up, show up, okay, just to get the J&J vaccine, okay? It's Wednesday tomorrow, Thursday tomorrow, from 5 p.m. to 9 p.m. in the City Hall, all right? So we try to like give out money to ask people to come and get the vaccine, but that is for the J&J, okay, vaccine. And also, as we speak, tomorrow and next week, the school is doing vaccinate the school kid also, okay? I don't think the school kid get any incentive except encouragement to ask them to come and vaccinate, okay? And then now this is the end of the June, and then by July, okay, we are planning to, assuming the J&J, all the vaccine are no good anymore, and then assuming that is the case, then we are planning to order maybe 100 doses at a time as for the state, so we can have in-home vaccination, okay? And also we have homebound too, okay? So far people call in and we call them back, and then the nurse will make a schedule with them, okay? So far we've done about 100 homebound, okay? People call in and then we call them back to have the address information, and then the nurse will head out and give them homebound, okay? During the springtime, we also did homebound too. For example, if we have a COVID clinic in the senior housing, we go into their unit and give them the shot too, okay? They don't have to come down, we go to them, okay? And that is the plan. And if they have any, we don't have a testing plan, but if they want to test for COVID, then they have to go to the CVS and the Walgreens, because we have 4 CVS and 2 Walgreens, so they always can go there. And also they can get the COVID vaccine in the CVS and Walgreens also. So that is our plan. I mean, as we speak, try to use up anything we have in-house, and then by July, assuming all the in-house are no good anymore, they may expire, and then we are going to order 100 doses at a time, because we don't want to have too many on hand, because we don't know the demand. So that is our plan.
Great. Thank you so much for sharing that plan with us. I think right now, I'm going to direct the question to Dr. Rongguan. Since Mr. Liu had just mentioned that there are these different kinds of vaccines. There's the J&J, which is 1 dose. There's the Pfizer and the Moderna, which are 2 doses. And I think people are concerned about sort of the various like safety and side effects issues related to these vaccines. So for Dr. Guan, can you help us just quickly summarize sort of what is the difference between the 3 vaccines, and what are the symptoms or like signs that people should watch out for when they get vaccinated?
Hi, thank you for inviting me to this discussion. It's very helpful. And South Korea Community Health Center, we have started vaccinating our patient or any Chinese or Asian population or anybody working in South Korea since December of last year. In the beginning, we have a very limited amount of vaccine, primarily just Moderna. But I think by February or March earlier, we got a federal surprise. So we actually have access to all different kind of vaccine. So we have been doing daily since then. And as of today, we did 25,000 vaccine. And in addition, some of our patients are getting it from TUF and BIDMC. So for our elderly population, I would say 75 and older, we probably cover 90-something% already get fully vaccinated. So we did a estimate, just a member count, like any given day, we ask our provider count how many people who walk into the clinic to see whether they get vaccine, and close to 95 of them already got. So our plan was to vaccinate everybody, and so they can go back to normal life. So the vaccine, the most experience we have is Moderna, because the reason we have that, because original when everything came out, Moderna is only required -20 storage. So that's, the Pfizer will require -70. That's a little bit tough for us. And also they come with a 975 dosage. So you had to use within a period of time. And Moderna is give us a little bit more time and easy to control. And later on, the J&J came, and we love it until the CDC basically screwed it up, because I love it because 1 shot is done. For those one don't really work in the clinic, getting the vaccine is very easy. Scheduling the patient come in and schedule the follow-up appointment, and not to make a mistake and giving the Moderna to the J&J or J&J give the Moderna. There's lots of headache, and plus the clinic is like a zoo. In the beginning in March, so it's pretty tough. So in terms of side effect profile, Moderna and Pfizer are essentially the same vaccine, mRNA vaccine. So and as far as I know, because Moderna have some secret lipid profile, so they're a little bit more stable. Therefore, they could be stored in -20 for a longer period of time. Moderna give the vaccine give 4 weeks apart, and Pfizer is 3 weeks. And their side effect profile is very similar. And Johnson & Johnson, they give 1 shot. So if I ask me to rank from clinic standpoint, from my own experience, I will wait. Moderna is the strongest one. The people keep, at the height of the, I think April, we are running crazy, because every time patient call in want to have a vaccine, I have to give them a choice. Then it's going to take forever. Oh, doc, which one's better? I say, I have no idea, just flip the coin. Okay. So, but some of them the main concern in the beginning for the mRNA vaccine is completely new. So people kind of hesitated. I'm sure you guys hear that there's a issue of Bell palsy, like seminal paralysis, and there's issue of anaphylactic shock, and it's brand new. Nobody knows what's going on. Actually, lots of patients waiting for J&J because it's more traditional vaccine. So, but now, like 6 months passed by, I think all of them are very safe. So, but if you really want me to ask from clinical standpoint, that how would I recommend a vaccine for someone? Here's what I think. If you're really hardcore, want the best vaccine, quote unquote best, I would get Moderna because that generates the most antibody. But in return, you get most benefit, but you had to suck it up because the side effect profile is a lot stronger. You have fever, headache, and muscle ache, and all those one. 50% of people have it. And it's funny, we were vaccinating the restaurant worker in Chinatown. Without mentioning the name of which restaurants, I'm talking to the manager. They say, hey, Dr. Huang, why do I just get everybody come to your clinic and we just vaccine 100 people? I say, I could vaccinate 100 people a day without problem. But the problem for you is that after the second vaccine, you probably have half them not coming back to work. Do you want that? He said, no, let's spread it out. So that's the Moderna. On the contract, J&J's vaccine, the side effect profile will be mild. Okay, so I tend to, give someone who's older or have more history of allergy, and I'm a little bit concerned about they cannot suck it up with the Moderna side effects, especially second shot. So that's my preference. The Pfizer, we got the Pfizer primarily because because that's the only vaccine and now can use for children 12 to 15. And Moderna, we don't have yet. We'll probably soon that available for kids. So that's the difference between 3 different vaccines. In terms of efficacy, Moderna and Pfizer are about the same, and Johnson & Johnson a little bit less, without going through the data. And because at the peak in March, I had to spend so much time to explain to the patient which one's better. Because essentially you compare orange and apple. The Moderna and Pfizer vaccine clinical trial was done last year in December or November or something. So at that time, the population of COVID are different from the J&J vaccine. The clinical trial was done in March. So they maybe have different variants. So therefore you cannot compare which one's more more effective. However, regardless, even the J&J claim they have less effective, but they also, people get J&J also don't have serious illness. So I think to me, that's good enough. So that's sort of an outline or the snapshot of what's the difference between 3 different vaccine. So, in terms of side effect, just like headache, fever, muscle ache, there's 3 of them. It's almost, if you don't know, just like some, oh, you guys get the vaccine? Jenny, you got it? Yeah, so did you have anything? You can describe it.
I got the Moderna, and
okay.
The first dose was okay. I had a little bit of sore arm. The second dose was, the reaction was pretty serious. I was sort of in bed for 1 day, but after I took some Advil, the second day, I think I was basically fine.
Yeah, so that's nothing. The side effect come out in 15 hours and last for 36. So I have the same thing. The only difference is that I was reading the New England Journal of Medicine because I was so bad. I said, okay, when I'm going to get better? So I'm counting my clock. 36 hours should be good. So, it's funny. I posted on Facebook, okay, let's survive today. See whether I can survive. That was bad. But someone like my wife, who's also a physician, she had nothing. So she go back to work and everything. So 50% of it. But, that's why I don't like to say the side effect is in the medical community. If you get a vaccine, that if you have no reaction, then you question whether you get the real one. Do you know what I mean? So you're supposed to have some sort of reaction. They have an immune response. So it's kind of funny. So that's why I explained to the patient. But I don't think, because we are pretty aggressive, reach out to our population. And plus, we are community health center. Most of the patients know us for 20 years. I don't have much resistance to convince my patient to get a vaccine. Some of them eventually come in. You know, I say, yeah, well, I mean, I have plenty of it. You just need to come in to get it. I guess sooner or later you get it. Otherwise, you're going to stay at home forever. So I guess go to the next one is after vaccine, what can you do? You still do wear the mask, you know, but you know, if I got a vaccine and Jenny, you get a vaccine, so both 95% protected, and you do the math, both of them together, again, we can hang out. So that sort of thing. It's psychologically is sort of relief. And now if you look at the data, is even more impressive. When we first have this vaccine rollout, people have doubt, and including us. And until the Israel data come in, because Israel is the country that get most of the vaccine, you see the COVID drop. And then the one key number, if you pay attention to the Massachusetts Department of Public Health database, in early March, we start opening Massachusetts this year. And that time, I think the COVID numbers still were thousands a day. So I was a little concerned. As soon as we open, after a week or two, we see the number of the COVID new cases going up. So I said, we get a third wave. I was worried about. But then that only lasts 1 or 2 weeks, and then we see the curves dropping like crazy. That's like almost like a coincidence with the aggressive vaccine we're doing. So we were very aggressive in March and April because I don't want to see this wave, at least in the Asian population, the Chinese population. Again, I want to vaccinate all my patients. So we get blankets. So I don't need to worry about it. Our staff don't need to worry about it. Like right now, we get 90-something percent of people coming to a clinic is already vaccinated. So, you know, it feels a lot safer that way. So is that fast enough, Jenny?
Great, thank you so much. Yeah, it's very helpful to hear from you comparing the 3 different vaccines. I think that at one point we hear a lot of people are afraid or hesitant around the J&J vaccine, especially because of the potential blood clot complication. And I think as someone in the chat has also mentioned, the probability of getting the blood clot complication is actually quite low. And at the same time, like the sort of general response from the population in general is actually more mild if you get the J&J as compared to like some of the other vaccines. So hopefully this will be helpful for people to like think about and decide what vaccines to get.
Yeah, I think one of the problem we're facing is the social media. I'm sure, you know, for Chinese people, they use WeChat. They got lots of mixed information from everywhere in the country, in the world. So, you know, I have patients that say, oh, actually, I was talking to one of my friends in China, a physician that recommend, the guy is 80-something, you know, recommend him not to get a vaccine. I was laughing. Because his reason was that, you know, I have COPD, lung disease, I have hypertension. I need to better control this one in order to get the vaccine. Well, forget it. The vaccine in China, they're not applicable for anyone older than 60. And the oldest patient I vaccinated in South Coast 108 and 106, a grandmother, my patient, she walked in. So I was telling them the only absolutely contraindication for this vaccine, you're allergic to it. So how do you know you're allergic to it? Really don't know. So you really need to ask. And for someone who has some reaction, we do have some reaction to the first dosage, like skin rash or something. It's really rare. We did 25,000, probably only less than a few. For those one, I do recommend not to get a second shot because it sounds. First of all, if you get a first shot, you get 80% protection anyway. So you get a Moderna, so it's okay. So overall, 6 months ago, I cannot say for sure because that's when we first have the new thing. I'm the first one in South to get the vaccine, the same day as Tony Fauci get it, and the same vaccine. So I guess if he's getting it, I'm safe, right? So 6 months later, we have 25,000 experience in front of us. So I feel pretty confident that the vaccine is very safe. In terms of long-term side effect, no one knows, only God knows. But the technology or the the myth or anything about mRNA, I think is overblown. You know, this is pure, it's such a pure vaccine. And it's also against, I know people say, oh, I want to get a Johnson & Johnson. The Johnson & Johnson, the vaccine also against the spike protein. Molecularly, it's the same thing. And you have the mRNA, which decays so fast, you don't need to worry about it. And Johnson & Johnson, at least you have a DNA. So I guess, you know, from scientific point of view, I think that's very pure and much way advanced, you know, technology and vaccine, you know. And, you know, we're looking ahead for the variant. We may or may not need it because Moderna and Pfizer are so strong. If we need it, it only take, you know, switch the little piece of nucleoside inside the bubble, and that's it. So, you know, I love it. Without this, forget it. You have to reinvent the whole gun again, like a Johnson & Johnson or any other vaccine. So I'm gonna stop here.
Yeah, thank you so much for sharing that. I think this is a good segue into let's hear a little bit from Timothy, our high school student on panel. If you could share with us your experience getting vaccinated. And I think that what I'm most curious to hear is there are, I think, some parents who are hesitant to let their children get vaccinated because they're afraid that, oh, you know, the technology is pretty new and we don't know what the effects will be in young people yet. So if you could tell us a little bit about how did you get vaccinated, what it was like, and what you might tell other young people and their parents about your vaccination experience.
Absolutely. So hi, my name is Timothy Guan. I am a rising junior in high school, and I am very excited to talk to you guys about my experience with the COVID-19 vaccine. So I got the Pfizer vaccine because I am under the age of 18. And I have to say it was a rather simple process for me to get vaccinated. I had to have my parents sign some of the papers because I'm a minor, because I'm under 18, but still it only took a couple of minutes for me to get vaccinated. In terms of symptoms, I think that I had more symptoms than most people did on average. I felt a little fatigued, I felt a little lightheaded, and I had some minor difficulty breathing. But a lot of these symptoms were alleviated after I drank some water, took a Tylenol, and I took it easy for a couple hours and got a lot of sleep. So those are some things I think people should do after they get their vaccine. It'll help you feel better. And so now, after I got the vaccine, I think that I feel a lot better. It feels a lot safer for me to go outside. I have like a newfound sense of peace of mind because the vaccine is helping me protect vulnerable members of my family from getting sick. So that's one benefit, one big benefit of the vaccine. And so I guess now I should address my thoughts about the vaccine, or if I ever had any concerns about the vaccine. To put it simply, I never had any concerns about the vaccine. Many months before the vaccine was publicly available, I was already researching the science behind how the vaccine worked. It's pretty interesting stuff. This is cutting edge technology. I know the vaccine is only made out of stuff that's found inside of found inside of our body already, and I know that, and I understand the design of the vaccine, and I understand that the design of the vaccine is what allowed it to come out in such record speed. So I trust the vaccine. I trust the process. And so like I understand that sometimes it's a little difficult to understand the science behind the vaccine, which is why I'm currently working on some material to help people understand the science behind the vaccine in a simple way that everyone can understand. Thank you.
Thanks so much, Timothy. Wow, that's incredible. And I, for one, would love to see what you come up with to help people better understand, you know, the science and to really sort of alleviate people's fears, basically. Thank you.
Yes.
And I want to also right now, you know, ask a similar question to Mei Hung. the executive director for CCC. CCC is an organization in Malden that works a lot with families and children. So our Asian community members are really familiar with May and all of the great work that she's done with families. May, I'm wondering if you have anything else to share about, why it's important for everybody, both parents and children, to get vaccinated, and maybe a little bit of your personal experience as well.
Sure. Thank you so much, Jenny, for giving me the opportunity to share my experience with the vaccine for the community. First of all, the entire staff team, actually, we registered to get vaccinated in April because we were anticipating maybe get back to the after school program in April, but instead we did not need to. So that was great, get us early started. Initially, I was very concerned because the vaccine came out sooner than I have expected, which was great actually. And through the process that I have personally did some study, and at the same time, we actually in mid-March, we were recommended by someone who have offered a workshop through a nurse who have done a very good, thorough explanation about what the vaccine, all the 3 kinds of vaccine worked. And so that we give us much more of experience and also feel more confident to do so. So all of our staff, we have 5 of our teachers, including myself, and program coordinators. We had all been vaccinated between April and May, early May. So we all had a very, personally, my reaction was very mild. The first day was a little, well, actually my arm was sore for 3 days for the first shot, and the second shot was less obvious. I don't know, but my husband and all my other co-workers and staff members were having much more stronger reaction. And again, just like Jenny, you said that you needed a day off to or like sleep more and rest for a day, and I think that was good. Most people did for 1 day or a couple of days. So overall, it's a very good experience, and I feel personally, it's so important to be vaccinated because after the vaccine done, and I feel more comfortable to invite a friend to come over for dinner. So that was the first thing I did because we all vaccinated, and of course my friend also did, so that we feel comfortable to socialize. And actually, a couple of weeks ago, we just had another couple of friends who came over to our house for dinner. So with the vaccine being vaccinated, allowed us to kind of really start to resume a little bit of our social life, and also feel more confident to go around on the street without feeling the concern, that kind of nagging fear in your head that you just don't know where you go, that would pose any kind of danger. So I would recommend everyone who hasn't really done the vaccine, go for it. Our mayor is back, and our mayor has actually, I saw his picture rolling up his sleeves to be vaccinated. So if our mayor do the vaccine, shouldn't we all be vaccinated? Yes. Thank you.
Thank you so much, May. That's a great call to action. And I also see that Mayor Christensen was able to join us. Thank you so much for being able to join, Mayor. Do you still want to make some remarks at this point?
How could I not? Because I just found out the event was at 6 when I thought it was 7.
Oh,
so I went to another event at 6. And let me just say, once I realized the error, in most moments like that, we would just say, let the organizer know we can't make it, or send someone else to represent us. But I quickly left the event I was at to get back to this event because I wanted to really take a moment to say thank you to you, Jenny and May, and everybody else on the call, because we would not be where we are today without you. It's just so ironic that we're having this town hall this evening after the headline in the Malden Advocate this past Friday, which says that Malden is #1 with the lowest COVID case rate of all cities in Mass.
Wow.
And when I saw this headline, I immediately thought of GMAC and the Chinese Culture Connection and our partners at the state who have been really doing the work to help us get this headline. And so I just wanted to make sure that I was here, whether it was at the beginning, the middle, or the end, to just say, Gonchi, Gonchi, Gonchi ni.
That's wonderful. That's wonderful. Yes, actually, during the since March, we have been prompting people to help them to sign up, and wherever when Malden has come up with any site that is available for vaccination, we will just really help people to guide them to where to go and all that, and help them to register if they need to. So thanks for Mayor for being so ahead of the game in making this is a priority for the community, and that alleviate a lot of fear. The living in a life that we have to worry about, where being contaminated with the COVID. It's just a very, very, very concerning, and so that we can live a little bit freer after being vaccinated.
Yeah, well, thank you again. I don't know if your board members are on here, but they should give you a raise, both of you, for what you have done for us. I mean, I think what I'll remember the most is that you got us to think differently. You just can't put the clinic information, in a newspaper or on Facebook. You have to get out and in to the community. And since you started doing that, we're now doing that. So, I just want everybody on the call to know that, again, I'm really near certain that we would not be where we are today without all of you.
Thank you so much, Mayor. It's heartening to hear that, our work has been paying off, and hopefully more and more community members are getting vaccinated. So I think this is also another great segue into our next slide. And also, if we could, I'd like to pass the mic over to GMAC's Vaccine Outreach Coordinator, Michelle, who has been doing so much of this outreach work. And we can summarize some of the upcoming vaccine clinics that are available in Malden, and where else can people get vaccinated, and if people need help, where can they seek out help. Thanks, Michelle.
So if we could advance the slide, just to let everyone know, the vaccine, you don't need any insurance or immigration status is never asked. You don't need an ID. There's no cost to the vaccine. And most of the clinics right now are walk-in. Currently, like Mr. Lewitt said, this week, Wednesday and Thursday at City Hall, we have a clinic going on. First 50 people get a $25 gift card. It's for the J&J vaccine, which is 18 years old and older. Next Monday, we have a clinic at Malden Catholic High School from 11 a.m. to 7 p.m. And of course, we had mentioned earlier the homebound program. If anyone is homebound, they can call Malden Board of Health to get their vaccine, and you can get it at home. The other thing is you can also get it from different healthcare providers, South Cove being one of them. Also, Cambridge Health Alliance is giving out vaccines. Anybody who needs help in terms of language or transportation for the vaccine, they can call the Malden Neighbors Helping Neighbors, our mutual aid group, and you can leave a message at the phone number. I think we have it on the screen now. There are 6 different languages. You can leave a voicemail and they will get back to you and help you with whatever you need and whatever barriers there are to get to the vaccine for you. There's other groups helping out with this. GMAC, of course, being one of them, Malden Neighbors, and also the YMCA and the YWCA. There's also the pharmacies, I think that was mentioned earlier, the CVS and the Walgreens. We have many of them who are also giving vaccines, but I believe those need appointments, so you would have to log online to schedule your appointment.
Great. Thank you so much, Michelle, for that summary. It's helpful to know like all of the different ways which people can get the vaccines. I wanted to just reiterate that for those who are listening either through phone or are not able to look at their screens, as Mr. Liu had mentioned earlier, the city of Malden is having public clinics at the City Hall this Wednesday and Thursday in the evenings, 5 p.m. to 9 p.m. People can walk in. There is no cost, no insurance needed, no proof of status or ID needed. Basically, all you need to do is go and be vaccinated. And the 2 clinics on Wednesday and Thursday evenings this week will be using the J&J vaccine. So anybody over the age of 18 would be eligible. And there is another upcoming clinic next Monday on June 21st at the Malden Catholic High School. That one is from 11 a.m. to 7 p.m. So for most of the day. And that's using the Pfizer vaccine. So anybody over the age of 12 is eligible. And you don't need to be a student or a family member of a student at the Catholic High School. It's open to the public. Anybody can go and be vaccinated. So those are upcoming clinics that are open to the public. And also CVS and Walgreens continue to do also vaccinate people. I think the only disadvantage right now is that they may not have language support on site. So if you speak something other than English, then it would be helpful to make an appointment beforehand. The appointment websites are also only in English. So if you want to make an appointment, one way to get help is to reach out to, as Michelle mentioned, Malden Neighbors Helping Neighbors, which is a volunteer mutual aid group based in Malden. And you can call their helpline, which is at 781-428-0789. And there are sort of channels for 6 languages. I think right now it's English, Spanish, Mandarin Chinese, and Cantonese. That counts as kind of like one together. And Portuguese, Haitian Creole, and Arabic. And if you speak, another language, for example, this webinar is also aimed at Vietnamese speakers. If you speak a language that is not one of the 6 current languages, it's okay. Just leave a voicemail anyway, and people will get back to you and help you make appointments and give you rides and, basically give any other kind of support that is needed for either getting vaccinated or pretty much anything else. The mutual aid group basically exists to help out people. So these are all great resources for Malden residents. And I think on top of that, also, as Michelle mentioned before, the state of Massachusetts is doing homebound vaccine program. And basically anyone who wants to can make a phone call and request to be vaccinated at home. Previously, you needed to have qualified as a state or local Board of Health confirmed person who is living at home and unable to get out. But right now, the state is basically loosening the criteria. So anybody who wants to get vaccinated at home can get vaccinated at home. And I think the number to call is 833-983-0485. And they also have multiple languages to help people request and get registered and then be able to get vaccinated at home. So yeah, we have a lot of great resources to help community members get vaccinated. I'm also wondering for Dr. Guan and Michelle, since both of you work at South Cove Community Center, I think at one point South Cove was reaching out to its patient database to get people vaccinated. Is South Cove still vaccinating people right now, or what's the status on that?
No, we continue to vaccinate, but the peak of the vaccine is in April. And the reach out is in the beginning phase when we gathering everybody who's 65 and older. We actually have a database pull out like a 5,000 patient. We call them individually. And if the nurse cannot convince the patient, then I will be on the phone convince the patient to get it, because those are most high risk. So up to now is that I was hoping that now we still have a few that we haven't got and they hesitated. So my my idea would be, okay, if we cannot get them, at least we get them in to talk about it, and then I can convince them. I think that would be the obstacle for us from now on to move, because those one who won, they already got it, okay? In the beginning of February, they pretend someone's caretaker, whatever, they figure out the way to get it. But those who doesn't want it, we need to convince them. But I think, as the relative and everybody's getting it, and he looking left and right, everybody's doing fine. I think those people will eventually going to get the vaccine. But I applaud the Malden city, and you guys do a great job. It's available for everybody. I think the mayor doing a good job. And you should, mayor, come to our health center. I give you all the vaccine at the same time, a cocktail. So you'll be Superman. I'm just kidding. Okay, no.
I actually could use that.
Great, thank you so much for that update. I think we have about 5 minutes until the end of the panel. At this time, maybe we could open up for Q&A, question and answer from either the audience or we also have some prepared questions for our panelists. So calling it out for all of our participants right now, people watching on Zoom, you can again go to the bottom and there is a button called Q&A where you could type in your question in the channel and we can answer your questions. And also, just also to reiterate from earlier, if you would like to listen in another language besides English, we have interpretation channels. That's also on a button at the bottom of your screen. It's a globe-looking thing with interpretation labeled, and one channel is for Mandarin Chinese, and there is another channel called German that is actually for Vietnamese. So hopefully you've all been listening in the correct languages right now. And let's see. So some questions that we've heard of before from community members that might also be helpful to address include, if I have already gotten COVID before, should I get vaccinated again? And also, I think on a related question, people are concerned about, well, I got vaccinated very early, and will I need to get a booster shot in a couple of months' time? So maybe that's a question for Dr. Guan.
Yes, the CDC recommendation is that whoever get the disease should still get a vaccine because the vaccine is so strong. Personally, we will recommend people to get it a little bit later. Even the CDC guideline recommend you get any time. And from our experience that people got the COVID and if they get the first shot, they usually have a little bit more reaction to it. It's more severe side effect. If it's someone who suddenly got the first dosage, have humongous reaction, we normally think, this guy may have a infection in the past. That's how it runs. But regardless, the answer is yes. If you get the disease, you still could get the vaccine. In terms of the booster shot, and this is kind of new because if you really learn immunology, once you one shot, two shot, your body sort of memorize what's going on, and eventually when the virus come in, they would kick it up. So I don't think people should worry about that much, especially if you're getting the Pfizer and Moderna, which is so strong. Your body should be able to handle it. And depend on the variant, Pfizer and Moderna is working on the booster shot against the variant. So we'll see what's going on. So.
Great, thank you so much. I'm wondering if either the mayor or Mr. Liu from the Department of Health has anything else that you would like to add to let Malden residents know about vaccines and upcoming plans or anything else.
Hi, Mayor, you want to go first?
Oh, I defer to you after all you've done, Mr. Liu.
Yes. Okay. I just want to make a quick mention about this. City of Malden in general, in the past, all the flu shot, any vaccine shot, flu shot, H1N1 shot, you name it, Malden always promote You come, we give you the shot. We don't check ID, we don't check residency, we check nothing. Just sign the consent form, and we never charge anything. City of Malden, we never say for residents only. City of Malden always promote, you come, we give you a shot. End of story, no question asked. So please come. If you have language problem, we will try to meet your demand, try to make things work. Especially right now, we have Google Translate. We can translate anything, make everything simplified. That is all I want to say.
Thank you so much. Mayor, do you have anything else to add?
Just to end by how I began, which is thanking all of you and also letting your viewers know that, you know, this thing is a marathon, not a sprint. So I know people have been excited about what's happened over the past several weeks, but we must remember to look toward the future, and health is a lifelong challenge. And so I would just caution everyone to continue to take care of themselves and to know that we will continue to be here for you.
Thank you so much. And I think with that, we are going to conclude our forum today. Thank you to all of our panelists for coming and sharing with us all of the scientific, clinical, and logistical information for getting vaccinated. We have on the screen again all of the phone numbers available for people to call if they would like to request help, either finding a vaccine clinic, getting an appointment, getting a ride, requesting for homebound vaccine, getting vaccinated at home, and also coming into contact with the community health clinics and the community organizations. And thank you again, and I wish everybody a very healthy evening, and have a good night.
Good night.
Thank you. Thank you, everyone.
Thank you. Bye-bye.
Thank you.
Thank you.